trying little.
Hey beautiful people, a very beautiful morning, beautiful afternoon and beautiful evening to every one of you. How are we all doing, guys? I know we're doing amazing. All right, shout out to those who has passed their Osce exam. I'm super excited for you guys. Too many messages. I can't wait to congratulate those of you that will be writing soon. All right, remember what we say. Osce is simple, nurses are brilliant and equal to the task. You will definitely succeed. Keep practicing with your peers, keep practicing with your pillows, and I can bet you will be successful. So in today's video, I am going to be teaching you community implementation. Now, if you're writing the old Osce, you could have community implementation in musts, which is the Malnutrition Universal Screening 2, or you could have community implementation charts in what we call PHQ9, which is Patient Health Questionnaire for the old Osce. But if you are doing the new Osce, you can have this community chart for MUST or for PHQ9. All right, so usually for most usually occurs in the community setting. So that's why when I did a video on most A to E assessment of most, I told us it could happen in the hospital or it could happen in the community. So if you are having a community assessment scenario, you will be having a community implementation chart. So this is the implementation chart for community. It is easy and it is straight to the point. Not too many things to read. It is easy and it is straight to the point. So in today's video, I will be teaching you how to do community implementation. Is that okay? So remember, for community, the patient will not be wearing wristband. Or let me rephrase that statement. A lot of times in community, 90% times in community, the patients are not wearing wristband. All right, I hope we understand. So guys, let's get started. Knock knock.
Hi, come in.
Hello, my
Hi.
name is Violet. I'm one of the community nurses.
Okay.
I was asked by your GP to give you some of your medication, which is due at 12 p.m.
All right.
Is that okay if I come in, please?
Yes, it's okay.
Thank you very much. So please, can you confirm with me your full name and your date of birth, please?
My name is Ellen Jones.
Fantastic. And your date of birth, please?
15th February 1940.
Fantastic. And your address, please?
NN27AL, that's my postcode.
Okay, so what about your address?
1 Sweet Street, Northampton.
Okay, fantastic. So with the paperwork I have here, that is very correct.
Okay.
So can I just ask you, do you have any allergies at all, please?
Yeah, I'm allergic to amoxicillin.
Oh, bless you. What happens if you take amoxicillin or when you take amoxicillin?
I usually have rashes all over my
Oh,
body.
bless you. I'm not going to give you anything containing amoxicillin. Your GP is aware and it's all recorded in your documents. Is that okay?
Okay,
So like I said, I'm from the community. I'm here to give you your 12 p.m. medications. Is it okay if we do it? Do you have any kids, any pets that might interrupt us?
No, no.
All right, fantastic. Can you show me where to wash my hands so that we can begin?
You can just wash your hands over there.
Okay, fantastic. So I'll do my hand hygiene according to World Health Organization. Palm to palm, right palm over left dorsal, vice versa. Fingers interlace, fingers interlock, fingers interlock, rotation of the thumb, tips to the fingers, and the wrist. My hands are clean. I will then put on my apron. And I'll put on my glove. Assessor, please can you confirm every of my equipment is clean and ready for use, and my drug cupboard is intact and safe to use?
Yes, they are all ready for you.
All right, fantastic. All right, so I pick up my implementation chart. This is an implementation chart for Ellen Jones. Medical record number is X012345. Address is 1 Sweet Street, Northampton. Postcode is NN27AL. Patient is allergic to amoxicillin and the reaction is rash. The date is today. The drug is metformin. This drug is not due at 12 p.m. I move over to the next drug. The date is today. The drug is lutetium potassium. The dose is 25 milligram. The time is 12 p.m. It is due at my time. The frequency is OD. The end date is in 5 days time. There's no special instruction. Prescriber signature is here, Dr. Z Khan, and the prescriber blip number is there. So I'm happy to administer this medication. Before I administer this medication, Mrs. Haley, I have here on the report that says your BP is 120/80. Is that correct?
Yes, that's correct.
So what's your BP? Can you say your BP to me?
120/80.
All right, fantastic. So guys, before you give any blood pressure medication, the BP has to be 120/80 and above. If it's below 120/80, please hold it. Explain to the assessor that the blood pressure is low and you would want to double check with the doctor before giving the medication. But if your assessor tells you, go ahead and give the medication, the doctor wants her to have the medication, then that's absolutely fine. All right. So in this case, the blood pressure is 120/80. I'm more than happy to give the medication. So Haley, lutetium potassium is a medication that is used to treat high blood pressure. All right. Okay. So the side effect of this medication is dizziness, nausea, and vomiting. All right. So I'm going to be validating the medication. This is my lutetium potassium. The expiry date is plus 5 days. This drug is valid. I'm happy to administer. Before I administer this medication, the doctor has prescribed 25 milligram and the drug is coming in 12.5 milligrams. So I'm taking 2 tablets. So guys, make sure you cross-check the milligram the doctor has prescribed and the milligram the drug is coming in so that you don't make a mistake. So in this case, I'll be taking 2 tablets. Never put your hand into the drug cup like this. Just take your 2 tablets now. 2 tablets. So because I've taken the 2 tablets, I'm going to put a dot on where I'm supposed to be signing. Just a dot. A dot, that's it. A dot where I'm supposed to be signing. Just so I know I have dispensed the medication and it's easy for me to go back there and sign. I move over to the next drawer. The date is today. The drug is paracetamol. The dose is 1000 milligram. The time due for this drug is 12 p.m. The frequency is QDS. The end date is 5 days and the patient has no special instruction. The prescriber signature, Dr. Z Khan, and blip number is here. I'm happy to administer this medication. So Haley, paracetamol is used to treat pain. It's an analgesic. It's used to treat and it's used to treat pain and relieve temperature. All right, it's actually an antipyrexia. All right, so can I just quickly ask you, have you taken paracetamol today at all?
No.
All right, fantastic, because it's just to be given 4-hour interval. All right, so the side effects of paracetamol could be nausea and vomiting, and of course you're not allergic to this drug. I'm more than happy to give it to you. All right, so I will check my medication. So guys, this is paracetamol. The expiry date of this medication is 5th of July 2024. So this drug is valid. I'm happy to give. The doctor has prescribed 1000 milligram. And the drug is coming in what? In 500 milligram. I will take another pot and I will dispense 2 tablets. All right, fantastic. So now, as I dispense the medication, one of them has fallen off. So this one that has fallen off, when I'm done, I'll discard it into the clinical waste. All right, so I'll put a dot to show that I have dispensed this medication. All right, so I move over. There's no more medication prescribed. These are just information for omitted dose, so no more medication prescribed. So Haley, I have all your medications here with me. I just want you to reconfirm your name, your date of birth for me, if that's okay. Can you reconfirm your name for me, please?
My name is Ellen Jones.
Fantastic. And your date of birth?
15th February 1940.
Fantastic. And do you have any allergy?
Yes, I'm allergic to amoxicillin.
And the reaction you said is rash. I don't have anything containing amoxicillin, okay? So I have here your lutetium, potassium. You're aware of the medication you usually take for your blood pressure. And I've told you it's for hypertension. And I have your paracetamol, which is for pain because you have osteoarthritis, so it's just for pain. And so that's all I have for you. Do you have any swallowing difficulties?
No, I don't.
All right, so I have completed all the rights of medication. I have the right drug. I have the right patient. It's going to the right route. So I have completed all the rights of medication. Do you want your drug with water or you want your drug with squash?
With water.
You want your drugs with water. All right, fantastic. So have your water and have your medication. Assessor, can you please confirm to me that my patient has swallowed that medication?
Yes.
All right. Can you open your mouth for me, Mrs. Jones? Just so I'm fantastic. So I'm happy to sign now that you have completed your medication. All right, so I've signed that the patient has completed the medication. So Ellen Jones, I'll be here for 30 minutes. So I'll be here for around 30 minutes. So if you experience any signs, any symptoms at all you need to do is give me a shout and I will attend to you. But if it happens when I have gone, all you need to do is to ring your GP or you call 111 or you call 999 to attend to you promptly. All right?
Okay.
Do you have any concerns for me, my darling?
No.
And have you eaten?
Yes, I've eaten.
Fantastic. All right. Thank you very much for your cooperation. I will take off my apron and I will take off my gloves and it all goes into the clinical waste. So guys, I just want you to take note of something before I leave. In community, you have to be careful. You must write your signature, your date, and your time. For community, I repeat, you must write your signature, your date, and your time. If you look at the screen, you will see how I signed it. So look at the screen, you will see I put my signature, I put my date, and I put my time. So if you only sign for community setting, you might just be failing. Not you might just, you will be failing. For community, it is stated there. Signature, date, and time. So it's not enough for you to sign. You must sign, write your signature, write your date, and write your time. Thank you so much, guys, for watching to the end. I will see you in my next video. Until I see you again, keep passing your Osce exam. I love you all. And bye.